We do have some good ones this time around. What else?
So this one's, hi Dave, please pass this question on to Dr. Rand. Question, my father is 71 years old. I'd like to know if he would benefit from TRT. He complains about low energy and also has some depression. His health is not bad, but he has a few issues such as type 2 diabetes and arthritis. It's also possible that he could be having an angiogram in the near future due to a minor issue found on a recent stress test. He had back surgery about 6 months ago to fuse the L1 through L4 and free up a pinched sciatic nerve. I'm wondering if TRT would help him with depression, energy, strength, and bone density in his later years. Is there an age or condition in which TRT could be recommended for elder men? Thanks to you both. For the YouTube Q&A, I believe I watched all your videos at least twice. Sorry about that. That's your fault. And I've learned quite a bit. Best regards, Sean. Sean, this is an easy one. At 71 years old, the likelihood that your father's producing enough testosterone to be healthy and to feel good is pretty much zero. I mean, unless he's a total freak of nature, in which case if he is, let's study him. But he's exhibiting all the signs of deficiency of testosterone. Low energy, depression, type 2 diabetes. This is a favorite one. Let me come back to that in a second. Arthritis, look, that's just from being on the planet and maybe riding a few too many bulls, God bless you. And that's going to be something that is probably best surgically dealt with, or some curcumin, things that help reduce your inflammation, etc. The heart too can also be helped, contrary to some popular belief, which has no real basis in the majority of studies. We know that coronary artery disease is associated more frequently with low testosterone. And of course the heart is a muscle which can be helped by testosterone. So depending on what the issue is, and always with the caveat that go to your doctor and make sure your cardiologist signs off on the TRT, but also make sure you get a second opinion if he doesn't.
Right.
Because I can't think of too many circumstances where the doctor would say no, it's not a good idea. But there are some.
Maybe they're from Canada.
No. In all seriousness, I mean, I don't want to. Never say never. Never make blatant statements. And I'm making blatant statements. I don't mean to do that because, for example, if someone has an arrhythmia of some sort, atrial fibrillation is very, very common. Sometimes, and it can be brought on by stress and inflammation. Sometimes TRT is not the best thing at that time until you can quell some of that inflammation, reduce the stress, because it can exacerbate, it can leverage that AFib through its effects, which is to leverage everything. So anyway, I don't mean to make it seem too obvious or general, but that is what I'm giving as general advice. Don't forget. For type 2 diabetes, I've had great success treating diabetes with just testosterone. Anything that helps muscle grow gives a place for that sugar to go, mm-hmm. which is muscle is going to help with insulin sensitivity. It's gonna give a place for, especially when you use the muscles, and you're not going to have them unless you're using them. It definitely helps reduce your fasting insulin and your hemoglobin A1C, which are all things you want to do if you have type 2 diabetes. So, and in terms of bone density, again, a no-brainer. Without those hormones, people think of estrogen as the main one for bone density, but no, testosterone ditto. And of course it has to be accompanied by weight-bearing exercise. But if Dad's 71 and active, and he's got some issues with osteopenia or osteoporosis, then this can only help. So this sounds like an easy one. Energy, good mood, strength, bone density. I would go through the motions like you're supposed to of getting labs done. Also, you want to make sure that there's not prostate cancer extant, because it's not the testosterone that's going to exacerbate it. It's what testosterone can get converted into, the dihydrotestosterone. So before you just pour testosterone in there, which can turn into something that can fuel the flames of prostate cancer, because every male, at least in the U.S., at age 82 roughly, has 100% has prostate cancer.
Wow.
71, you're getting closer. Let's just rule it out. You can do it with like a multi-parametric MRI, where you can visualize the prostate. There's a guy in Holland who can get it down to a 3 millimeter visualization, which is maybe 2 million cells. That's early stage, in other words. But in the later stage, see it. You want to do this, and I'm not saying don't go ahead and go forward with TRT necessarily. Refer to your urologist and your oncologist if it's extant. But we discussed earlier, you could maybe treat it with testosterone, and testosterone is not the bad guy here.
Mm-hmm.
Progesterone and testosterone are considered to be protective. It's the dihydrotestosterone. So maybe consider going on TRT with the blessing of your doctor, with something to block the conversion to dihydrotestosterone, a 5-alpha reductase inhibitor. So anyway, just be smart about it. But yeah, I would definitely consider doing this. Anything that you can do to help with the muscular tone around the back could also help the L4, L1, L4 stability, whether they do a surgery or a rhizotomy or whatever they do to fix that. So all these things that are in bad shape for him sound even the arthritis could be helped. Why you stabilize the joint, you're less likely to irritate it or create more arthritis. You can look at it that way. I don't mean to be reaching too far, but it's a good point. I mean, if you don't have it, I'll admit I got plenty of arthritis. I need 2 shoulder replacements for 15 years now, and I'm told often that and I see it in my patients all the time. When a patient has that much more muscle mass to hold the joint stable, particularly the shoulder, which is really just this bone hanging off this other edge of a bone, you're less likely to aggravate and create more arthritis. So all these things sounds like it could be helpful to Dad. I would definitely look into it. This is what we would call a no-brainer.
Awesome. Thanks, Doc.